Hello everyone, my name is Dr. Marty Kotlar. Thank you for attending this webinar. I want to thank Dr. Siegel for inviting me to do the presentation. I enjoy doing these and I hope everyone does too. All right, I'm going to switch the slides. You should see the slides changing across your screen. Today's topic is massage therapy, how to add it to a practice. And I'll tell you a little bit about myself before we get started. I am a chiropractor. I practiced for 16 years. And about 10 years ago, I started Target Coding. I'm the president and founder of the company. I'm also certified in CPT coding and certified in healthcare compliance. I write articles for a lot of chiropractic magazines. And I'm also a member of the American Chiropractic Association and the American Academy of Professional Coders. I'm a speaker for the Coding Institute, Parker Seminars, Foot Levelers, and I'm a guest speaker at many national and state Chiropractic Association conventions. So let's get started with the advantages and disadvantages of including massage therapy to your practice. There are pros and cons to this, so let's go through a few of these. First, it's going to add another dimension and approach to your practice. As the doctor of chiropractic, you don't have to do the soft tissue work anymore. Now, this may be restricted in certain states, but most states allow chiropractors to hire licensed massage therapists. Most states allow medical doctors and osteopaths to hire massage therapists. Most states allow massage therapists to work under the supervision of nurse practitioners, podiatrists, physician's assistants, and physical therapists. So, if you have a massage therapist working for you, make sure they're licensed. Get a copy of the license. Make sure that they are licensed to practice in your state. So now, in some states, massage therapists are allowed to do other modalities. Like, for example, in the state of Florida, licensed massage therapists can also do ultrasound and electrical stim, and they're licensed to be able to do modalities. So please check into that. So if you have a licensed massage therapist doing that and is able to do that in your state, then the doctor of chiropractic could just focus on adjusting. So it's going to add additional services, revenue. You can put together a whole marketing campaign on massage therapy to your practice. There's some disadvantages. You're going to have more overhead. You're going to need more room. And you may need to cover the malpractice costs of the massage therapist. So those are a few of the things that you should be aware of. Now, as far as setting up the situation, you're probably going to hire the massage therapist as an employee. You could have the massage therapist work with you as an independent contractor. You could have the massage therapist rent space from you. So there are a few different arrangements that you can create. Maybe you could even partner with a massage therapist and form a new corporation. So you should look into that. But most of the time, you're going to hire the massage therapist as a regular employee, take taxes out, just a regular employee, and this allows you more revenue potential and you have control of the situation. You're going to have some more billing responsibilities and more malpractice exposure, but overall it's pretty straightforward. You as the employer, you're going to do all the billing under the employer tax ID number, and then the massage therapist is going to get paid a salary. Employer receives all massage therapy gross revenues less the massage therapist salary, taxes, and overhead attributable to the massage services. I strongly recommend you have the massage therapist sign an employment agreement which outlines the duties, the responsibilities of the massage therapist, the compensation, arbitration, non-compete, non-solicitation, sick pay, vacation time, health insurance, continuing ed. All of those things should be outlined in the employment agreement. If you're going to have the massage therapist come in and rent space from you, that's great. You can get additional revenue just from the rent. The rent should be fixed in advance. It shouldn't be based on patient referrals. It should be based on the fair market value in your area, so you can rent space to the massage therapist. You want to make sure that you outline everything that the massage therapist can do under the rental agreement. You want to put together a sublease agreement. If you don't own the building, you want to check with your landlord to make sure you can sublet a portion of your office to the massage therapist. Now the massage therapist is going to bring in his or her own patients. Massage therapist is going to take care of all the financial arrangements directly with the patient. You're not involved with that at all. You're just getting rent. You're just renting out a room to the massage therapist. And again, the rent should be at least 1 year in duration. It should not be based on patient referrals or patient volume, and the rent is based on 1 year duration, and it's set in advance. It shouldn't be fluctuating every month. Those are the standards, but check with an attorney. You must check with an attorney once it comes to subletting space or any type of contractual arrangements. Okay, now let's talk about massage therapy being a medically necessary insurance reimbursable service versus a wellness type non-insurance reimbursable service. There are two types of ways to approach this. There are two types of massage services. Again, a medically necessary insurance reimbursable massage versus a wellness spa type massage, which is not reimbursed by insurance. So let's go through the medically necessary massage situation first. First thing you need to do is a history. You need to talk to the patient, and you want to come up with a complete history. Again, this is for something that you're going to bill. So if you're going to bill an insurance company for massage, you first have to do an evaluation. So that includes history. There are 4 types of histories. You should see them on your screen. The massage therapist is not doing the history here because massage therapists cannot bill out for E&M codes. We're talking about billing out for a medically necessary service. So we have to create the foundation here with a history. So example, Mrs. Jones, how did the problem start? When did it start? So you have to go through a history. There are 4 types. Problem-focused history. That would equate to CPT code 99201. An expanded problem-focused history, well, that's 99202. A detailed history is 99203. And a comprehensive history is 99204 and 99205. So let's just talk a little bit about the detailed exam. You see it on your screen there. Detailed is 99203. So, well, I can tell you 99203 is the most commonly billed new patient CPT code. Now I'm talking about MDs, osteopaths, chiropractors, all the providers, nurse practitioners. You put them all together. Those are the doctors that bill E&M codes. Well, 99203 is the most commonly billed. So most of you listening to this presentation are using 99203. So that means you did a detailed history. You see, when you bill an insurance company, whether it's Medicare, Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, Allstate, Cigna, PI cases, workers' comp, you bill 99203. You're telling the insurance company a lot of information. You're telling them you did a detailed history. What's a detailed history? Hopefully you all know what this is. If you don't, let me share with you. That means you have written down or you've entered into your system, your computer software program, at least one chief complaint, 4 HBIs, 2 to 9 systems were reviewed, and 1 item from the past history, family history, or social history was documented. You must have those 4 items. Again, at least 1 chief complaint, 4 HPIs. Now, HPI stands for History of Present Illness. In chiropractic college, you may have been taught this as the OPQRST. So you need 4 of those. So I'll give you an example. Mrs. Jones says she has pain radiating down her leg. It's throbbing. It's worse in the morning, and ice makes it feel better. Those are examples of HPIs. So you need 4 of those. Next, system review. You have to review systems. You're required to review systems with the patient. There are 14 systems in the body. There's the musculoskeletal system. Hey, that's the one we're going to be focusing on. But there's also the respiratory, cardiovascular, GI, GU, constitutional, which is your vital signs, ears, nose, mouth, throat, hematologic, lymphatic. There's a lot of systems in the body. We're focusing on the musculoskeletal system. So You're going to need to do a little bit of system review. 2 to 9 systems need to be reviewed. And 1 item needs to be reviewed as far as the past history, family history, or social history. A past history example might be, patient stated that she's never had any trauma to the spine. Family history, patient stated that her mother has osteoporosis and osteoarthritis. Social history, patient smokes cigarettes, drinks alcohol socially on the weekend, exercises 3 times per week. So make sure you're documenting the history properly. The next step to proving medical necessity leading up to the massage being billed is to do an exam. You must do an exam. The doctor has to do an exam before the patient. See, I look at the massage therapist as the receiver, and the MD, DO, DC is the quarterback. So example, chiropractor sees the patient, does a complete, thorough evaluation, and now as the quarterback is going to throw a pass to the receiver, the massage therapist, and now the massage therapist sees the patient. But the MD, DO, DC first has to evaluate the patient, must do an exam. Here you see on your screen, same deal. Problem-focused exam is 99201. Expanded problem-focused exam is 99202. A detailed exam is 99203. Comprehensive exam, 99204 and 99205. So now let's go back to the detailed exam. What is that? You have to have 12 findings, 12 exam findings. They could be positive or negative. For example, range of motion in the neck was normal, full range. You get credit for a finding. Vital signs, 3 vital signs count as 1 finding. Checking for range of motion counts as a finding. Now here's where it gets a little tricky. A patient comes in with low back pain and you say, okay, Mr. Jones, bend forward. That's lumbar flexion. Patient has restriction and pain. Then you say, okay, Mr. Jones, bend backwards, extension. Also restricted and painful, inflection and extension. Does that count as 2 separate findings? The answer is no. Whether they're all positive or all negative, it counts as 1 finding. Orthopedic neurological tests also all counts as 1 finding. Similar in the neck. You do range of motion on the neck, you do foraminal compression, and then you do cervical distraction. All of those findings, whether they're positive or negative, count as 1. So make sure you are counting up your findings properly. So we have range of motion. We have assessing for asymmetry and joint laxity and subluxation. We have assessing for pain and tenderness, postural evaluation, tissue and tone changes, muscle spasm, muscle weakness, the skin. If you see a rash or a lesion on the patient's neck or back, that counts as a finding. Or just saying there's no scars, rashes, or lesions, that also counts. Reflexes, sensation, pinwheel, even a brief mental assessment stating patient appears to be oriented to time and place, that counts as a finding. So make sure you have 12 findings. If you don't have 12 findings, then you have to down code to a 99202. So that's a little bit about the exam finding. There's a lot more, but remember, this is a massage therapy webinar. So now comes the decision making. After the exam, after the history, now you need to come up with a diagnosis. Remember, this is for a medically necessary massage that we're leading up to. You have to have a diagnosis. So here, just a little reminder. Or maybe this is brand new for some of you. I don't know if this is a reminder. But the definition of medical necessity, the definition of medical necessity is a very long definition. This is just a portion of it. So portion of the definition of medical necessity says the items or services being provided must be reasonable and necessary for the diagnosis of an injury or an illness to improve the functioning of a patient. So the diagnosis is huge. You have to use the most appropriate diagnosis codes. So hopefully you're doing that. This is, I just put up a sample page of a book. This is a book that I strongly recommend everybody get. It's called CPT Diagnosis Code Linking. So here's an example. This is an excerpt. This is one page out of the book. Massage therapy 97124 is the CPT code. And then all the diagnosis codes here are listed. Well, these are just a few. There's, I don't know, probably 50 or 60 diagnosis codes that link to massage therapy. So this book that I'm referring to gives you every 9-7 code that you would probably use in a typical chiropractic or physical therapy practice, like traction, electrical stim, ultrasound, therapeutic exercises, neuromuscular reeducation, therapeutic activities, massage therapy, manual therapy. It lists the CPT code and all the associated diagnosis codes. So make sure you're using the right diagnosis codes. Now, this is an excerpt of one page out of the book. Please do not email me asking for a copy of this page. It's not going to be given to anyone. It's just for you to see how the book lays out. If you're interested in the book, then just send an email to amy@targetcoding.com, amy@targetcoding.com, and she can get you information on the book. The next part of creating a care plan that leads up to billing insurance for massage is goals. You need to set goals for the patient. How do you start setting goals? Well, take a look at the form. You should have good quality patient intake forms. You may be able to start gathering baseline numbers from the intake form, just from talking to the patient. Ask the patient about how does this particular problem prevent them from doing their normal daily activities. When you do an exam, you're doing range of motion. Get baseline numbers in the exam and set goals from there. Your goals have to be feasible. They must include a time frame. As the patient meets their goals, you need to update them. Once the patient meets their ultimate long-term goal, then you have to transfer the patient over to wellness care. And we're going to go over that specifically for massage. Massage and wellness is coming up soon. After you set goals, you're going to start outlining what you're going to do. This is also part of decision-making. What are you going to do on the patient? You've got a lot of choices in a typical chiropractic or medical practice, physical therapy practice. You could do ice packs, hot packs, electrical stim, traction, manual therapy, massage therapy, obviously, therapeutic exercises, neuromuscular reeducation, therapeutic activities. Maybe you're going to order DME, x-rays, do diagnostic testing like EMGs and NCVs, send the patient out for a consultation, chiropractic, acupuncture, strapping and casts, kinesiotaping, orthotics, spinal orthotics, foot orthotics, functional evaluations, nutritional consultations, weight loss programs, lab work, functional evaluations, trigger point therapy. There's a lot of things that you can provide, but let's stay focused here on massage. So you want to outline specifically that you're going to be doing massage, why you're doing, what's the clinical rationale. You need to know the clinical rationale for massage. There's a definition of massage that should be in your care plan that sets the table. Very important. Email us, email amy@targetcoding.com if you want that clinical rationale or that definition of massage therapy. You're going to outline that. Where you're going to do the massage, how often, the frequency and duration, what part of the body, for how many minutes per visit. So that's all outlined. It's not difficult. Once you get this figured out and you know what needs to be done, it's very simple. If you're hearing this for the first time, you may be saying, wow, that's a lot of work. It's not. Once you figure it out, you know, it's like I watch the Food Network a lot, and I see them making these, these dishes. And every time I watch the person making the dish, the chef always says, it's so easy. You just get a little onion, a little garlic, and they make it seem so easy. And I'm looking at it because like, wow, this looks like a very complicated dish. So once you get the recipe and you do it a few times, yeah, it's easy. Initially, it sounds very difficult and complicated. But once you do it a couple of times, you're going to go, wow, I didn't realize This isn't too bad. So next you want to outline the schedule of care. Patient's going to be seen how many times per week and for how many weeks. You must outline a frequency and duration of care. That's important. As a matter of fact, many insurance companies require it. Again, we're talking about insurance reimbursable, medically necessary massage. Most carriers want to see frequency and duration of care. You have to outline. Now, that's not a full treatment schedule. That's a portion of the care plan. Now, let's get into some specifics regarding billing insurance companies for the massage. Under the Therapeutic Procedures section of a typical CPT code book, you'll see a manner of effecting change through the application of clinical skills and/or services that attempt to improve function. One-on-one contact is required each 15 minutes. So the CPT code for massage therapy is 97124. 97124. Pretty straightforward. This includes effleurage, petrissage, tapotement. 97124 is the CPT code for massage therapy. Now, do insurance companies pay for massage? Some do. A lot do. Medicare pays for massage when a physical therapist does it, when a nurse practitioner does it, an MD or DO. Medicare will not pay. Unfortunately, Medicare will not pay a chiropractor for massage 97124. But they will pay a PT and many other healthcare providers. So we have massage. Now, massage should be used as a preparatory procedure to set the patient up for another procedure being done, a therapeutic procedure that's going to restore function, reduce edema. That's the expanded description of massage. It's used to restore muscle function, relieve spasm, decrease stiffness. Now, another CPT code that's associated with massage therapy work is manual therapy, 97140. CPT code 97140 is manual therapy techniques. Example, mobilization, manipulation, manual lymphatic drainage, manual traction. See, there's manual traction. That's different than mechanical. Mechanical traction is 97012. This is manual traction. So this is another procedure that most massage therapists are licensed to be able to perform. There's a big difference between these two. You can't do the same thing and bill two different codes. If you're doing massage, you bill for massage. If you're doing manual therapy, which is different than massage, then you bill manual therapy. Some providers confuse that. They'll say, well, I'll do the same thing, but this insurance company pays for 97124. Next patient, I'll do the same thing, but this company, I'm just going to bill 97140 because that's what they pay. Careful with that. There's a difference between the two. Now, here's another thing you should be aware of as far as 97140 and 97124. The National Correct Coding Initiative edits created by Medicare require that manual therapy, again 97140, and massage 97124 be performed in a separate anatomic site if you're giving the patient a chiropractic adjustment. So therefore, if you're going to do the massage or the manual therapy in a separate anatomic site than the chiropractic manipulative treatment, then you're going to add the 5-9 modifier to the 97140 or the 97124. You're not going to add the 5-9 to the CMT. So now let's say you have this all figured out, you got it done, you know what to do, you send in the bill, and then it comes back like this. Denied. How do you prevent this denial? Benefits are denied because the diagnosis is inconsistent with the procedure. What happened? You did not use the right diagnosis codes. If you want to learn which diagnosis codes are used with 97124 or 97140, that's the book that I was mentioning earlier. So send an email to amy@targetcoding.com, and she'll get you information on this book that I'm referring to that's called CPT Diagnosis Code Combining. And that'll dramatically reduce any denials you're getting because of this comment here. Benefits are denied because the diagnosis is inconsistent with the procedure. For some staff members, they don't know how to tackle that. They don't know how to troubleshoot that. They don't know what to do. The doctor doesn't know what to do. And then that's how the insurance companies win, because they got away without paying you. Now, I'm going to give you a little surprise quiz. Let's say you do 10 minutes of massage on the lumbar region and 10 minutes, let's say, of therapeutic exercises. So 10 minutes of each, and then chiropractic adjustment to C5, T1, and the right SI joint. How would you bill this? Can you bill for both of those time services? See, according to Medicare, one unit is 8 to 22 minutes. But now I'm doing two services, 10 minutes each. Can I bill both? No. You could pick 97124 or 97110. You must pick one or the other. You cannot bill both because you have to total up the amount of time spent doing all the time codes. In this example, you only got up to 20 minutes. 8 to 22 is one unit, so you'd only be able to bill one unit or one code. And then 98941 would be for the 3-region adjustment. So just wanted you to be aware of a little bit about the billing requirements. Now here's a sample massage therapy soap note. This is something that if you want to get a copy of this, send an email to amy@targetcoding.com, amy@targetcoding.com, and she could send you the sample massage soap note. It's very straightforward. It's very compliant. It meets all the documentation requirements that most insurance companies are looking for. This is something that the massage therapist would fill out and would get attached to the rest of the soap note. If there's anything else being done, let's say the chiropractor is doing an adjustment or the physical therapist is doing some traction, so you may have 3 different healthcare providers seeing the same patient. Everybody has their own soap note. You combine them all together. But this is a sample massage therapy soap note. You're circling here. Patient comes in, low back pain, low back stiffness, feels it 75% of the day. It's annoying, it's stiff, and rates it an 8 out of 10. Also complaining of neck pain and right SI joint pain, feels it 50% of the day, rates it a 9 out of 10. It's tight and sharp. The third complaint is right shoulder pain. Rates it a 5 out of 10. It's dull, it's stiff, and feels it 25% of the day. There's tenderness in the lumbar and cervical paraspinal muscles. Range of motion was decreased in right shoulder adduction. Assessment, patient's about the same. What do? We did massage on the lower back, the right SI joint, the neck and right shoulder for a total of 60 minutes. We're recommending the patient come in 1 time per week. So there we go. Treatment plan is 1 time a week. Massage therapist should not be changing the diagnosis without speaking to the doctor. Massage therapist should not be making any major changes to the diagnosis, the care plan, the services being rendered without speaking to the provider who's supervising the services. That's why I mentioned before, the massage therapist is the receiver. The healthcare provider, for example, MD, DO, DC, is the quarterback. So the receiver cannot make any changes unless they check with the quarterback. Now let's talk about massage therapy for wellness care. But, before we even get that, when you're calling to verify coverage, again, let's stick with massage for medically necessary purposes here. You also want to do a insurance verification. You want to call the insurance company to verify that massage or manual therapy is covered. While you have the insurance company on the phone, ask them if the massage is performed by a massage therapist. Does the chiropractor have to be on site? Can the massage therapist perform the procedure at all? There are some carriers do not pay if the massage therapist is performing the massage, even though it's within the scope of practice of the doctor. So check with that when you're doing your verifications. Now let's talk about massage therapy for wellness care. So, wellness care, massage therapy has a wellness component. Chiropractic has a wellness component. Physical therapy has, most services have a wellness component. But what's wellness? What's maintenance? Well, maintenance or wellness care includes services that seek to prevent disease, promote health, and prolong and enhance the quality of life, or maintain or prevent deterioration of a chronic condition. A wellness program consists of activities that preserve the patient's level of function and prevents regression of that function. Maintenance begins when the therapeutic goals have been achieved. Wellness care is not typically covered by insurance. So please understand the difference here. There's a difference between medically necessary insurance reimbursable massage and a wellness massage. Wellness massage, I'm sure those of you listening to this presentation, there may be a hotel in your area, a resort where people go for massages. There's no insurance coverage for that. You may have a franchise like Massage Envy in your area. There's no insurance coverage for that. So there's a big difference between wellness care and active, therapeutic, medically necessary, insurance reimbursable massage. Now, wellness is getting bigger and bigger. It's more popular nowadays than ever before, especially when it comes to the federal government. To me, it doesn't matter if you're a Republican or Democrat. The administration right now is doing more about prevention than any other administration that I've ever been part of. So recently, the Health and Human Services announced $372 million grant to 44 communities to support public health efforts to reduce obesity and smoking, increase physical activity, and improve nutrition. The awards are part of the Health and Human Services Communities Putting Prevention to Work. It's part of the new ARA, or the Patient Protection Act, or healthcare reform, whatever you want to call it. This is an unprecedented level of commitment to prevention. Investing in local communities will build a healthy America. The aim is to reach more than 50 million people who are living in these communities. So there's the website. If you want to learn more about it, there's a website. And, you can see more information if you go to Medicare or CMS.gov, and you could read a whole bunch of new programs in place now. Dr. Dean Ornish, I don't know if that name rings a bell to any of you, a medical doctor who specializes in nutrition and weight loss. A portion of his wellness program is now paid by Medicare. So wellness prevention is something that's being addressed a lot now, more than ever. So now let's talk about massage as a cash service here. Wellness, let's continue to talk about it. We've been talking about it for a few minutes now, so let's continue. Massage as wellness, as cash. So let me just inform you that you could only do services that are within your scope of practice. So if you're a massage therapist listening to this, check your state board. If you're a chiropractor, medical doctor, check your state board for the rules, statutes, and regulations regarding massage. Now, massage as a cash service is much less complicated than the insurance model. You don't have to prove medical necessity to an insurance company. You still have to prove medical necessity to your state board. You still have to prove medical necessity to a malpractice carrier if there's ever malpractice situation involved. But as far as insurance goes, this is cash. Now, if you're charging insurance for medically necessary massage, and then you also have patients coming in for cash wellness massages, you got to have the same fees. It should be the same fee for both. You shouldn't be charging more to insurance. Just because they have insurance, you can't charge more. That's a violation. Now, you could provide a little small discount, or you can join a company like Chiro Health USA, which is a discount medical plan organization, That's something you can do where you can get a much bigger discount. So on the transition visit from active care to wellness care, make sure to provide a little summary, a little discharge summary about going from medically necessary insurance reimbursable massage to non-insurance massage. Tell the patient, Mrs. Jones, good news and bad news. The good news is you've reached maintenance. The bad news is your insurance doesn't cover wellness massages. Would you like to continue to come in? Here's the fee. This is what you need to pay out of pocket. This is not insurance reimbursable because you're doing great. And let the patient make a decision. Let's say they go, yeah, I'd like to continue to come in. Fantastic. Let's say a patient is not sure. Say, you know what, Mrs. Jones, we can let you go now. We can discharge you. If you have a problem in the future, a flare-up, an exacerbation, a new problem, come back in and we'll start billing your insurance again. You could do that too. Let the patient go. Now, when the patient returns and they had a triggering event like, hey, doc, I was doing great. I went down to tie my shoes and now my back is killing me. Or, hey, massage therapist, everything was going great. Just woke up this morning. My neck is so stiff I can hardly move it. So now we have a triggering event. So now you want to set the table again by doing a history, exam, diagnosis, start the wheel in motion again, and now start billing insurance again. And now this is medically necessary insurance reimbursable massage. Treat the patient for a while and then transfer them back to wellness. If you're going to have to bill the insurance company for a wellness massage, some patients don't get it. You know, you tell them it's not paid by insurance. That we're talking about wellness massage. A wellness massage is not paid by insurance. Patient has to pay out of pocket, and they're paying you. Great. Now, all of a sudden, out of the clear blue sky, the patient says, give me a bill. I want to send it to my insurance. And you say, well, no. Wait a second. This is not insurance reimbursable. This is a wellness massage. And the patient says, I don't care. Give me something. I want to send it into my insurance. Great. So then you can use HCPCS code S8990. Okay, just a couple of closing comments here. You must check with all the carriers you bill prior to submitting claims based on the information provided in this presentation to ensure that it is compliant. Target coding does not guarantee that the information provided in this presentation will guarantee payment from any insurance carrier or patient. Target coding is not responsible for any insurance carrier or managed care organization laws, rules, guidelines that may change following this presentation. Please understand that insurance carrier laws, rules, and guidelines can change, so it's important to stay your best, stay on top of any changes that may occur by attending seminars, webinars, and joining your national and state professional associations.